Hi everyone, today I'm going to be reviewing how to do a BUBBLE HEE assessment. If you're not aware, on BUBBLE HEE, it is a head-to-toe assessment that is geared to postpartum mothers. We can do this assessment regardless if they had a vaginal birth or cesarean birth, but either way, this is something that tells us how mom's doing and how mom can cope once she is discharged. So BUBBLE HEE is an acronym, and that basically just stands for the different parts that we're going to assess in the postpartum mom. So B stands for breast. We're going to assess both breasts of mom. We're going to assess her uterus, her bowel and her bladder, the lochia, if she had an episiotomy, any hemorrhoids, her emotional state, and education. If you don't know how to do a head-to-toe assessment, I do have another video on that. Go ahead and review that first. I used this diagram for that, but I wanted to throw this in here just because there's different ways of doing the BUBBLE HEE assessment, just like there's different ways of doing the head-to-toe assessment. In the video that I have posted, my best suggestion was to literally go from head to toe. When you're adding in the BUBBLE HEE component, I still go head to toe, but as I get to certain areas, like the breast and the uterus, I'll add them in when I go. So for example, I'd be done with the head. Once I was done with the chest, I would then assess the breast. Then after I'm done with the stomach, I would then assess the uterus, bowel, and bladder. That's not the only way to do it. I know some of my classmates do head to toe first and then BUBBLE HEE at the end, whatever makes you most comfortable, but I like to go in the order of my head to toe and adding in the components as they come, just so I can better remember everything. So our first part of BUBBLE HEE is the breast. After you get done with your head and your chest, listening to your lung and heart sounds, you're going to assess the breast. You're going to inspect the breast for any discoloration, swelling, or redness. You're going to want to ask mom if she's breastfeeding or bottle feeding, and if she's having any trouble with breastfeeding. If she says no, you can move on. If she says yes, kind of ask her what's going on. Maybe baby isn't latching as well as she wants, or maybe it's painful. That way we can either get a lactation consult for her, or we can have her ring the call bell when she's ready to feed again, and maybe we can come in and assist her. Maybe it's just a position thing. Either way, if she's having trouble, try to have her call on the call bell the next time that she feeds. Also, we're going to want to touch the breast, so make sure you ask permission if it is okay to touch mom's breasts. And you're just going to be wanting to feel for any engorgement, any tenderness, if she's having any pain, things like that. Second is the uterus. I wanted to throw this next slide in here just so we can talk about the uterus a little bit. Although we are not doing this assessment while baby is still in the womb, I wanted to show you about how big the uterus is when there's a baby in there. It just doesn't deflate right after labor either. It does get smaller, but it doesn't go back to its normal size right away. The top of the uterus is called the fundus, and the bottom of the uterus is called the isthmus. I wanted to throw that in there so that way when I talk about assessing it, you kind of know geographically where we're talking about. So this is the fundus, and that would be the isthmus. So back to the uterus. You're going to want to touch and feel mom's uterus. We want the uterus to be firm and not boggy. If the uterus is boggy, you're going to want to massage that fundus. That's kind of the main three words with maternity that I think I've said the most. You're going to want to massage the fundus if it's boggy. There's other pharmaceutical measures you can take if the uterus is boggy. We can administer oxytocin, pitocin, things like that to kind of help the uterus contract because we want that uterus to be firm. after we get done with the uterus, we kind of can hit the next 4 things pretty easily. We have bowel, bladder, lochia, and episiotomy. So once you get done with the uterus, you can ask mom, has she had a bowel movement? When was the last time she had a bowel movement? This will vary depending on if mom has had a vaginal birth or a cesarean. If mom had a vaginal birth, she might say that she did pass a bowel movement during birth because pushing and bearing down can sometimes cause a bowel movement to occur. That is still a legible answer. If she had a cesarean, it all depends on how long this assessment is after her cesarean. Maybe her epidural is still kind of wearing off, so she might not have all that much feeling. You want to ask her if she did have a bowel movement, was it painful, things like that. You just kind of want to get a feel for how her body's returning to normal function. As far as bladder goes, if mom had a cesarean birth, she may still have a Foley catheter in. So you're going to want to assess the catheter site. You're going to want to check the bag for the color of the urine. If mom had a vaginal birth, you're going to want to ask her when's the last time she urinated. If she was able to measure how much she urinated, you're going to want to get the volume. Also ask her if she's having any pain or burning while she's urinating. That would be some questions that you could ask. Now with lochia, if you're not familiar with what lochia are, it is basically discharge that is excreted through the vagina after birth, and it can be either a vaginal or cesarean. The amounts may vary, but you will still have it either way. This is just a diagram that I found online that kind of shows you how we can measure our lochia. When we're measuring lochia, we want to look for amount, color, and odor. Basically, mom would have some type of Depends or underwear on with a pad on it, and we would just assess the pad. What's the color of the lochia? What's the amount? And we can use this scale right here. And is there any odor to the lochia? And lastly, we have our E, which is episiotomy. An episiotomy is just an assisted cut for a vaginal birth. And if she did have an episiotomy, we would treat it just like any other regular wound. So we would use our acronym RETA. So with the episiotomy, we're going to be looking for redness, edema, ecchymosis, drainage, and approximation. So basically, once you get done with the breast and the uterus, you can kind of assess bowel, bladder, lochia, and episiotomy all within the same general area. So that kind of gets the bulk of your bubble HEE done fairly quickly. H stands for hemorrhoids. I don't have a posterior picture of this woman, but basically what you would do is have the woman roll onto her side. You cannot have the woman roll if she has had a cesarean birth, just because of that incision site. And I also want to go back and mention too, for the episiotomy, if mom did have an incision site, we would also use RETA here for that as well. That's not really in the bubble HEE, but you'll know it when you see it, and it'll just kind of become second nature to assess that as well. But as far as hemorrhoids, if mom did have a cesarean, we do not want to roll her onto her side. So checking for hemorrhoids might be a little difficult for that situation. If mom had a vaginal birth, however, we are able to turn her onto her side. We would lift the gown up, check for any hemorrhoids, ask if she's having any pain. Another part of H, which is done in some facilities and is not done in others, is Homan sign. So Homan sign is basically just a check for blood clots in the lower extremities, so down here. And while your mom would be laying down in the bed getting an assessment, you would basically just take her feet and flex them up, and if she had any pain, that might be an indicator that a clot has moved down to her lower extremity. The last two components are emotion and education, and these are kind of done throughout the entire BUBBLE HEE assessment. As far as emotion goes, you're assessing that from the second you walk into the room. Is mom upset when you walk into the room? Is she happy? Is she crying periodically throughout the assessment? Does she seem depressed? Things like that. Look at her surroundings. Does she have family members in the room with her? Has she had any visitors at all? Kind of ask her what her discharge plans are going to be like. Will she have support at home? Is the father of the child in the picture? Things like that. We just want to assess mom's emotional state so we can try to promote the best plan of care for her once she's discharged from the unit. And lastly, education. That's also a thing that happens throughout. I mentioned that when we assess the breast, we could have mom either get a lactation consult, or she could ring the bell and we could try to educate her the next time that she feeds, things like that. Basically, with education, is the mom receptive to your help? Is she willing to take what you have to say? Is she willing to do your suggestions, or does she want nothing to do with you and feels that she has her own way of doing things? Alright guys, that's a quick overview of how to do a head-to-toe assessment with the BUBBLE HEE aspect of our postpartum mothers. Don't forget to like and subscribe.